back now. At a time when the pandemic is peaking in India and resources are scarce, can virtual monitoring of patients help ease the pressure on hospitals that they are facing currently? Now, British health tech firm Huma helped the NHS during the spike in cases in the UK in creating virtual wards in some areas to monitor and care for patients who had moderate symptoms of COVID while they were in isolation. Patients had to fill out their details, their oxygen levels in the app 3 times a day, and then they were monitored virtually. The aim is to see how healthcare teams can get patients to hospitals at the right time for better outcomes and better support them through early interventions. Huma now wants to urgently help in India in any way that they can, given the pressure on health services and hospitals here, and they want to do it pro bono. Well, to talk more about this, we're joined by Dan Vadat, founder and CEO of Huma, and Dr. Matthew Knight, consultant respiratory physician with the NHS. Thank you so much both for joining us. Mr. Vadat, first to you, tell us about Huma Health Tech and how did you help during the COVID surge in the UK?
This is a good question. So as you know, Huma, we have been active for many years in the field of bringing digital first care hospitals at home across different diseases, from rare disease to chronic diseases. And when COVID happened, we decided, the whole company and all of our partners, to put our efforts and focus to build a technology that we call it COVID hospitals at home, together with our partners, UK government, Germany governments, clinicians and healthcare systems in those centers, so that we can keep patients and deliver care when they are still at home. And if only they need to come to the hospitals, they can come in and utilize basically hospitals' limited resources, oxygen devices, and so on and so forth. And the way it works, it's very simple. It's a simple application. When you have COVID, it gets prescribed to you almost like a pill. And then the applications tells you what to do, how to do it, when to do it. It connects to certain devices like oxygen saturation device, which is a very important one. And then all the data and insight goes to the clinical team in the hospitals. And then suddenly we can flag someone might have hypoxia, which, as you know, quite dangerous for the COVID patients, or someone is deteriorating. And then clinical teams can remotely intervene, have a video call, ask patients to do certain things and manage it all at home. Or if the patient really needs care, only bring it when the care is needed.
All right. So, Mr. Vadat, how do you think you can help in India, especially since this is all tech-based, it's app-based? Would this involve you tying up with hospital groups or local governments?
Yes, we've been observing, because we also have a team in India, and the stories was really sad, and we really felt we have to do something, and we were thinking, how can we bring all the learnings and experiences we got in Germany and UK to India? And as a result of that, we committed to do these initiatives pro bono for the time being, especially right now that there is a huge urgency of help. And by bringing our COVID hospitals at home, helping certain hospitals and healthcare systems to double their capacity, hopefully, but also enabling a wider reach to rural areas, because that is where most of the challenges usually are, and all the other benefits that simple technology like this can bring. And as a result of that, together with our ecosystem of our partners and help of certain governments, we are in contact and collaborations with different states, cities, and healthcare systems. We are due to go live in Pune with a first series of our projects to impact hopefully a large number of patients. And the beauty of our technology is we can roll it out really fast. At the time, we had the day that we rolled it out to 100 clinics/hospitals here back in Europe. And hopefully we can repeat the same things with some impact during this really hard time for India.
Well, Dr. Knight, I'd like you to come in here and, tell us what you think about the India situation and how this technology could help. This is something that would apply more for, our big cities and our big hospitals.
So I think that the benefits are threefold really to the use of this type of technology. It's very simple because it requires only the upload through a smartphone of very basic data. But the benefits are to the patient because it allows the patient to be kept at home, to communicate with their physician, to be reassured. And anxiety is a big contributor to the need to see a doctor. And it's a very anxiety-inducing period of time when you see people all around you being unwell. And I worked in Tamil Nadu for a year and a half many years ago. I have a lot of friends in southern India particularly, and likewise as it was in England at that time. Reassurance is very important for a patient, knowing that they're safe, or if they're not safe, having a little bit of time to be able to plan a hospital admission is really important. To the physician, it's a big time saver. It allows local doctors to be able to manage far more patients, as well as tend to the needs of other patients, because all the people with heart attacks and strokes and cancer, they haven't stopped getting sick. Those patients are still there, in addition to all the new patients.
All right, so Mr. Vadat, have you thought about rural areas? Because that is where we're now seeing this pandemic spread. How would you, manage to help in these rural areas since there is a technology challenge?
Definitely. Obviously, we are still in a learning curve in terms of the best way to support different part of the countries. We would need as many help as we can get from different healthcare systems and governments and groups that are focused on delivering care to patients. It's a teamwork. The beauty of technology is it does not require any presence. When we rolled out our technology in Germany, we had 0% in Germany on the ground. So the fact that you can deploy these solutions all remotely, I think is a plus. And in terms of technology requirement, it does require some minimal technology like connectivity, some simple smartphones. Hopefully in each family, there's at least one person that might have access and they can use that phone and share that phone with the patient and for the patients potentially, or sometimes people have it and that's kind of the approach we are taking. But anyone that can help to help us to put our technology in more places and impact more people, we would love and we would welcome that.
All right. Well, Dr. Knight, again, how comfortable are patients using an app, to imagine that they're being monitored virtually?
So our feedback was very good from patients. They liked it. They liked the fact that the thing they liked the most was actually getting an acknowledgement from the doctor that they had seen their data. They felt reassured by that. We allowed patients to select whether they wanted to use the app or not. So in our particular cohort, about 50% of the patients that we offered use of an app for accepted it. The most common reason for not wanting it was because they didn't have a smartphone. And even that time saving allowed us to just proactively telephone the patients who didn't use the app. And so we didn't have everybody using the app, but the 50% that did meant we saved so much time. We had time to telephone the other patients and sort of proactively phone and get that data in. So the patients who used it, the feedback was very good. They liked it. Had feedback from patients that they liked looking at their numbers on the phone, because you could look over the trended data and you could see, well, I was 93% SATs 7 days ago. I'm 95 today. My heart rate's better. And you can see that visually. So when the doctor does contact you and says everything's getting better, it's reinforced. You say, well, I still feel bad because I've had COVID, it's a nasty infection, but actual fact, objectively, I'm better than I was a week ago, and that's a good news. It's good news. So it's very reassuring for patients. So as well as saving a lot of time for the system, allowing patients to be safer, we have anecdotes of patients who actually didn't feel that unwell, but their oxygen levels were going down, and we proactively admitted those patients to hospital.
All right. Finally, Mr. Vadat, now it's very fascinating to see how technology has expanded into the healthcare sector. Before the pandemic, we didn't even have too much medical telecounseling here in India, at least. And now everybody is doing it. Of course, your app involves a lot of artificial intelligence.
That is true. I think pandemic and the pressure that it put in healthcare systems globally forced everyone to be more innovative and adopt technology. And the beauty of technology is simple, scalable, and relatively cost effective. And in some scenarios, even also very safe, because if you can manage your chronic conditions or preparations for your surgery or any other diseases as much as possible in the comfort of your home during the time that a pandemic is happening and you might be exposed to the virus if you travel, as an example, I think it becomes almost no-brainer and the impact and the stats that has already been published from the works that we have done, it shows massive savings. It helps some healthcare systems to double their capacity, reduce admissions and readmissions, but also more importantly, help the limited resources to be delivered to the people that they need it at the right time. Even, if a patient gets sick and come too late in the hospitals, that the same patient would take a lot longer to heal. And that means taking a lot longer bedtime, oxygens, and other technologies that the hospitals has. But if you bring it at the right time, you might be able to look after the same patients in 2 days instead of 20 days. And that is the opportunity.
All right. Well, Dan, Avadat, and Dr. Nai, thank you so much for speaking to us here at NDTV. Well, that's all the time we have on the show. Thanks so much for watching. Goodbye.